好，嚟到第36條呢，我哋就考埋查樹油 N 咯喎。究竟啦，我哋利用呢個查樹油 N 搽落個傷口嘅時候啦，究竟有咩影響呢？咁而家啦，呢啲人呢，受試者呢，佢係有傷口噶啦，而呢個傷口呢，亦都已經受到呢個細菌 X 所感染。咁我就將佢分做兩組人啦。第一組人呢，就有呢個敷料消毒咗嘅敷料，而呢個敷料呢，係搽咗呢個查樹油 N 嘅。第二組啦，亦都有呢個消毒咗嘅敷料，但係啦，呢個敷料咧純粹消毒咗就揞住傷口嘅啫，係冇加到呢個查樹油 N 落去嘅。咁得出嚟嘅結果就係啦，第一組嘅傷者咧，佢哋嘅傷口周圍係冇呢個紅腫現象嘅，而第二組啦冇搽到查樹油 N 嘅咧，個傷口周圍係出現咗紅腫現象嘅。其實呢條題目就係考翻我哋有關於炎性反應嘅概念啦，係咪啊？同埋啦，呢個都叫做實驗探究啊，係咪？所以啦，都係考翻我哋有關於實驗嘅設計啦，同埋得出結論嘅。咁喺入題目之前啦，有一個小問題，我想問下大家，就係喺第一組同第二組呢兩個裝置底下咧，究竟邊一個係對照裝置 （control setup）？咁你喺留言區留低你嘅答案，睇下你嘅概念清唔清？咁而家啦，我哋就入題目咯喎，咁啊睇翻題目咯喎，下面邊一句啦嘅陳述咧係最能夠形容得到查樹油 N 對個傷口嘅影響嘅。咁啊頭先都講過啦，根據實驗結果咧，我哋研究緊嘅係炎性反應，咁我都借助呢個機會咧去溫一溫書炎性反應究竟係點嘅咧？受損細胞釋出某一啲嘅化學物質，令到傷口附近嘅小動脈舒張，亦都增加咗微血管嘅透性。流去傷口嘅血流增加咗，亦都有多啲嘅吞噬細胞離開微血管，吞噬病原體同埋將佢哋消化。與此同時啦，炎性反應我哋就話發炎啦，究竟有啲咩嘅病徵呢？就係血流增加咗啦，令到傷口變紅同埋發熱，而組織液嘅積聚咧，亦都令到傷口腫脹咗，而腫脹嘅組織咧產生咗壓力，刺激咗皮膚嘅痛覺感受器，從而引起痛楚嘅。咁呢個釋放某些物質係咩嚟嘅咧？咁舊版嘅教科書咧就冇特別提到嘅，但係新版嘅教科書咧就有講到啦。嗰樣物質就叫做 histamine 組織胺。咁就算用舊版教科書咧，過往啦，我自己啦，同埋不少嘅同工咧，其實都一定會教學生嘅。你當課外知識知多少少叫 histamine 都好啦，組織胺呢一樣嘢，從而啦就引發咗呢個炎性反應咯。咁而家我哋睇下答案啦，做咗擊破啦。咁A 嗰句佢就話啦，查樹油 N 咧係能夠增加咗傷口附近嘅毛細血管，即係微血管啦嘅通透性或者滲透性。咁其實呢個概念咪即係話啦，即係話容許更多嘅吞噬細胞離開咗個微血管去打病菌咯。咁但係你諗下啦，呢個係炎性反應嚟嘅喎。但係啦，根據第一組嘅結果，查咗查樹油 N 咧，傷口周圍係冇炎性反應嘅喎，所以呢一句咧實質係錯嘅。因為啦，查樹油 N 照計應該係能夠避免到炎性反應嘅病徵去產生，所以佢應該係抑制咗呢個微血管嘅通透程度、滲透程度增加嘅呢件事。所以啦，第一句就 say goodbye 咯。然後啦，就去到第二句啦，佢能夠抑制到傷口組織胺嘅釋放，呢個就係答案啦。因為書本都有講到啦，受損嘅細胞係會釋出組織胺，組織胺就會令到傷口附近嘅小動脈舒張擴張，同一時間咧亦都增加咗個微血管嘅通透性、滲透性，從而咧就令到我哋傷口發炎咧就有呢個紅同埋腫嘅現象。不過而家查咗查樹油之後咧，係冇呢個紅腫現象啊嘛，咁即係話唔定呢個查樹油 N 咧就能夠抑制到傷口組織胺嘅釋放啦。而去到第三句啦，佢係個強力干擾答案嚟嘅，就係啦，查樹油 N 係可以殺死感染傷口嘅細菌 X 喎。喺呢個實驗探究當中，我哋淨係知道咧呢個傷口周圍係冇紅腫現象啫。而題目啦，亦都真係有提到我哋兩組嘅受試者，其實佢哋個傷口已經受到細菌 X 嘅感染，而 而個實驗啦，亦都真係冇提過，喂，傷口附近嘅細菌咧，佢哋個數量有冇變化到啊？佢少咗喎，多咗喎，冇講過嘅。所以呢句説話咧，我哋係無從判斷嘅。咁啊，C 就 say goodbye 啦。嗱，咁有關於 B、C 呢兩個答案咧，我再講多少少。咁啊，因為大家始終係真係會覺得唔係咧。如果啲茶樹油 N 咧真係殺咗啲細菌嘅話啦，咁其實咪唔會發炎咯。嗱，諗真啲，一句説話。首先啦，傷口已經係受到細菌感染㗎啦。咁呢度有兩個信息：第一，有傷口；第二，受到細菌感染。而炎性反應係由邊個引發起上嚟嘅？係當組織受損嘅時候，係咪啊？受損嘅細胞就會釋放組織胺，去令到附近嘅小動脈舒張啊、微血管嘅透性增加。其實呢個已經係引發咗炎性反應嘅象徵嚟㗎啦。因為你個身體介損咗之後啦，嗱，除非你把刀已經好多細菌嘅啫，係咪？咁即係話啦，介損咗就只係講緊你個身體表面多咗一個細菌入侵、病原體入侵嘅途徑，對不對？咁你個身體就要預備定啦嘛。哎呀，而家有傷口喎，咁我就放定啲物質組織胺啦，引發炎性反應先令到啦有多啲嘅吞噬細胞去到呢個地方預備打仗。可能有仗打，又或者可能冇仗打，唔知道。題目亦都講啊嘛，真係有細菌嚟咗啊嘛，咁即係話一定有仗打啦，係咪？我哋退一步去諗，哪怕茶樹油 N 真係殺咗啲細菌，我真係當嘅啫。但係傷口仍然係傷口，你嘅組織係咪受損咗？佢哋係咪會放組織胺，引發呢個炎性反應，對不對？所以啦，喺 B 同 C 之間，我哋要追嘅，喂，發炎喎，點解啊？就係因為組織胺嘅釋放引發炎性反應，所以 B、C 之間咧，我哋一定係揀 B 嘅。而去到 D 咯，就係茶樹油 N 咧，係促進咗傷口嘅血流量，更加錯啦。因為其實同 A 呢個選項一樣嘅啫嘛。茶樹油 N 本身應該係能夠避免到炎性反應嘅病症，所以佢應該係抑制咗多啲血去流去傷口嘅呢件事嘅。咁所以啦就唔係增加佢，咁所以咧 D 咧都 say goodbye 啦。咁過往啦都有好多有關於發炎嘅題目嘅，點樣愛你變害你啊，炎性反應啊。其實今年嘅長題目講電子煙嗰條咧，正正就係愛你變成害你嘅跡象。咁遲下解長題咧就慢慢再講啦噃。In question 36, we are going to study the tea tree oil N, and we are going to investigate the effect of the tea tree oil N on wound, and people with wounds already infected by the bacteria X were divided in two groups, one group and two groups, so with different treatment, and then let's see the result. First group, cover the wound with the steroid patch applied with tea tree oil N. And for the second group, also cover the wound with the steroid patch without applying the tea tree oil N. And what about the result? In group 1, there is no redness or swelling around the wound, but for group 2, redness and swelling develop around the wound. Actually, this question is checking us the concept about the inflammatory response. And also, because it is a scientific investigation, we are going to check your skills about designing an experiment and drawing conclusion. So, let's take a look at the question. Which of the following is the most possible effect of the tea tree oil N on the wound? And I would like to grab this chance to talk about the inflammatory response first. Chemicals released by the damaged cells cause dilation of the arteriole near the wound and increase the permeability of the capillaries. And blood flow to the wound increases and more phagocytes come out of the capillary to engulf and digest the pathogens. And we can observe the sign of inflammatory response or inflammation. The wound becomes red and hot due to increased blood flow and is swollen due to the accumulation of tissue fluid. And it is also pain because pressure build up in the swollen tissue, stimulate the pain receptor in the skin. And I would like to remind one more thing. It's about the chemical released by the damaged cells. In the old version of the textbook, it doesn't specifically talk about histamine, but in the latest version of the textbook, they include the name of the chemicals, histamine, to initiate the inflammatory response. So no matter the textbook include this name or not, I trust that all the teachers will teach you this concept. So let's go through the answer one by one. So for option A, tea tree oil N increases the permeability of capillary near the wound, which is incorrect. Because we know that for group 1, there is no redness and swelling around the wound. It means that there should be no inflammatory response. So it seems like that tea tree oil N prevented the sign of inflammatory response. It should inhibit this process. It means that it should inhibit the permeability of capillaries increases, this phenomenon. So option A, say goodbye. And then for option B, the tea tree oil N inhibits the release of histamine in the wound. It is correct. As why I say that histamine is released by the damaged cells and it will cause vasodilation and increase the vascular permeability. That means the capillary permeability, leading to the observed redness and swelling. However, we know that in setup 1, there is no redness and swelling. It means the inflammatory response is inhibited, is prevented. Therefore, option B is the possible effect. And then for option C, which is the powerful distractor, tea tree oil N, it seems like to kill bacteria eggs infecting the wound, which is incorrect. First of all, both groups start with the wound already infected by the bacteria eggs. However, the experiment result did not mention the change of the population of the bacteria in the wound. So we never know that does the tea tree oil N really kill the bacteria. But the idea is that even the tea tree oil kill the bacteria or not, the cells, they are damaged already. So the damaged cell will release the chemicals, the histamine, to initiate the inflammatory response. So it makes us to think about that, maybe the release of histamine is really inhibited. Because even there are some bacteria here, but what if I can really inhibit the release of histamine? There will not be inflammatory response, right? So option C, say goodbye. And finally, option D, tea tree oil N promotes blood flow to the wound. Same idea as option A, prevent the sign of inflammatory response, so it should inhibit this process, not increase it. So option D also say goodbye. So in the past, there are different questions about the inflammation. And before the end of the video, I want to ask you one question. In between group 1 and group 2, I want to know which group is the control setup. So leave your answer in the comment section and let's see your concept is clear or not.